Welcome to the space where knowledge meets the action. Welcome to the Empowering Show, where we break down the barriers, helping you grow. Financial literacy, speaking truth to the power. Real conversation, changing lives by the hour. We inspire to change, here we challenge the status quo. Sharing tools for building wealth, watching your seeds grow. Empower you to take control of your future. No more living in the past. We're the authors of the suture. Get ready, get set, let the movement begin. Because empowerment starts now. Let the light in.
All right. Thank you guys for tuning in. My name is Kendall Stevenson, and I am the host of the Empowerment Show. We're on the PA Empowerment Network. You like what you hear, you can pick up the phone. You can always give us a call, or you can leave us a comment. We are live, and we try to bring you the latest and the greatest of what we have out here. Now, today, I have a really good guest, and I'm going to introduce her in a minute. And please remember that the people that come on the show are community people. These are people within our area, which would be Monroe County, East Stroudsburg, Pocono Mountain. We know the area. And I like to bring people on that's going to enlighten us, give us some knowledge. This young lady happens to be in the medical field, which is good for me because, as all you guys know, I am in remission from cancer. So we talk cancer, we talk medical, we talk keeping your little asses healthy, if you want to say. So again, my name is Kendall Stevenson, and we always start this show off by being grateful for something. As I tell you guys, when you wake up in the morning, you take that first breath, please know that doesn't happen by accident. There's a much higher power than you that wakes you up in the morning, in the evening, in the night, whatever time of day it is that you rise. But you rise with help. So please just be grateful for what you do have: a place to sleep, a roof over your head, some food in your stomach. There are many of us out there that don't have that. And let me see, I think I hear her at the door. Yeah, let me bring her in. Hey, how you doing, Miss Connie? It's real good to have you on our show. I know we get a little long-winded sometime in the beginning, but it is what it is. So we're going to talk medical today because I understand you are Nurse Connie. Nurse Connie, you have your microphone on mute. You're going to have to push that little button on your microphone.
There we go.
There you go. We want people to hear what you got to say, so they can tune in and maybe want to ask you a question or two. So what type of nurse are you?
I am a registered nurse, and my specialty is critical care. My background is the intensive care unit, emergency department care, trauma, as well as progressive care unit.
So if I get sick, you're the person I want to see, right?
Yes. Yeah.
At least help prevent me from getting sick. So we're in right now. What's going on? What kind of diseases we got going on right now that we should be looking out for?
Well, mostly for our community, it would be chronic diseases, high blood pressure, diabetes, heart disease, kidney disease. Mostly that's what's affecting our community, as well as obstetrics, GYN, gynecological issues like women's health issues, maternal health. Those are the big ones for us, for our community.
So why is it that African American women, they have the highest death as far as maternity is concerned?
Well, according to research, there's a lot of, unfortunately, racial disparities that are present in our community, reduced access to care, a lot of inequalities in and inequities that are still taking place, income, social determinants of health, location, access to healthcare, those types of issues really affect our community still. Yeah.
Mm. So what are you saying? Systemic racism, along with a lack of resources, is causing this type of trauma within our community?
Sadly, yes, it's still present. Systemic racism is a thing. Um, it's still present. It's still prevalent. Um, a lot of healthcare issues are continuing. We're moving forward, but sadly, within the past, I would say 2 to 3 years, we've had some setbacks. A lot of resources and funding has been reduced or eliminated as far
Mm.
as access to care.
Mm. So just a quick question. How about doulas and midwife? Would you recommend that for our community, for the women in our community, that maybe that would prevent some of the loss of lives?
Absolutely. Just based on tradition and history from years ago, midwives and doulas were the primary care for a lot of pregnant women. And throughout time, when they realized that um, black black infants and the mortality rate was much more improved, those positions were eliminated. Um, and then once the doulas and the midwives were eliminated from that position, there was an increase in infant mortality and black maternal death mortality as well, infant mortality as well as maternal mortality, meaning the mother. So I highly recommend reinstalling doulas and midwives. They currently have, I believe, Governor Shapiro just passed a bill through the Black Maternal Health Black Caucus that is out of Harrisburg to
Hmm.
find funding for doulas and midwives for the state of Pennsylvania. So that's something that recently passed within the past year.
From what I've been hearing, you know, people, we hear different things, so it's kind of hard to say what is and what isn't until it actually comes out. But from my
Mhm.
end, they wanted to do away with midwives in the state of Pennsylvania. They're not
Nope.
looking to help or fund them; they're looking to do away with them.
Nope. There's a bill. I'll have to look it up and I could get back to you on that. But I was just doing some research for um, another project, and Shapiro, through the Black Pennsylvania Black Caucus, they were able to pass that bill to get funding. So it was a bipartisan bill, and
Hmm.
they should be able to get midwives, resources through Medicaid and Medicaid, and resources for doulas.
Well, I hope so
So
that that
that in
happens
itself is
because
increase
right,
care.
you know, I mean, as far as the healthcare, especially for our women, I think they need to have better resources so that we can get better care. Because you know, for a very long time, women, and when it came to the medical field, they were not very recognized. They even as far as research is concerned, I don't think they actually started doing research on women until like the 80s or 90s. It was like really late when they actually got deep into what affects women. So just to ask you as a woman, how often do you think a woman should report to the doctor? Get a pap smear or a mammogram? Or those things are important, right?
Um, I believe, like, they have clinical practice guidelines that should be followed. Uh, but one recommendation I would personally make, especially with pap smears, they recommend that if you're married, you should not necessarily get a pap smear because the understanding that you have the same partner. However, I believe that you should still get an annual pap smear, because as long as you're sexually active, it's important, and that's the best way to catch any sexually transmitted diseases. And it doesn't matter if you're married, because sometimes there's infidelity. So just to err on the
So
side of
just
caution, you should, as long as you're sexually active, you should be getting an annual pap smear.
so just to make it clear, I'm a man. I apologize. I am what I am. So what exactly is a pap smear? Why should I take? What's it for, and why should I take one? Why is it that important? I know you'd say to check STDs, but what is it exactly? A pap smear? Oh, did I lose you? I got a smile.
You froze on me.
Can
Yes, you
I
froze on me.
froze?
Okay,
Oh,
now
I
you're
was.
there.
Oh, okay. I saw
Yes.
you freeze. Okay, so what exactly is a pap smear?
Well, a
You
pap
froze.
smear is a
Okay, there
diagnostic
you go.
test that can detect cervical cancer. You can
Okay.
get it done by a gynecologist, and they go in, you go to your provider, usually with a GYN background or your internal medicine physician, and they also have nurse practitioners that are OB/GYN certified, that can do pap smears as well. And you
Oh,
basically, they go in the cervix, and they swab the outer surface of it, and it's then sent to the lab for diagnostics. And
is it
there's different
painful?
levels to the pap smear.
Is it painful?
Um, it should it should not be painful, but it can be if you have lesions or some sort of
Mm.
abnormal bleeding or anything that's out of the ordinary going on in the vaginal or cervical canal. But it should not be painful. It's uncomfortable, but I wouldn't say that it's painful. So yeah.
Is this a yearly thing that they should do? Bi-yearly? Because I know when I go to get a colonoscopy, usually it's like 5 years before you have to take 5 to 10 years. Is that the same with a pap smear, or is that
I think
recommended to take one annually?
the clinical guidelines right now, it's every 2 years. However, in my experience and being a board certified cytotechnologist prior to becoming a registered nurse, my understanding is that if you're still sexually active, you should be getting a pap smear every year. You should be getting a pap smear every year.
And the
Because sometimes,
mammogram, the same kind. Oh, I'm sorry.
yeah, because sometimes the abnormality, if you have a lesion, the pap smear may not detect it for 3 or 5 years. That lesion could be what they call atypical squamous cell lesions, or it could be a low-grade lesion. So there's different levels before it gets to, say, a high-grade lesion, or that one step right before cancer, carcinoma in situ, or cancer level. So it can take years. So that's why it's important to go annually to get a pap smear, especially if you're sexually active, because a lot of them can progress from viruses like the HPV virus, the human papilloma virus, which has different strains. They have a benign strains and then multiple malignant strains. And then those are the malignant strains of the virus is the one that can progress to cancer. And so you want to catch that before you get to cancer. And that's the whole purpose
Mm.
of the pap smear. Is it's a screening tool to screen for cancer prior. So yeah.
Okay, you said something. I learned something. So the mammogram.
Okay.
I've heard from different women. Some women say it's a painful experience. It's not a painful. What is the purpose of a mammogram, and how often should a woman take that?
The mammogram, again, those guidelines have just decreased. It's down to I believe it's 48 years old. 48 years old. And if you're considered high risk or have a family history of breast cancer, you should be going in much sooner, like in your 30s. So say for myself, if my mom had a history of breast cancer, I wouldn't wait until the normal screening age of say 45 or 50. I would go in because my mom has a history of it. That puts me at a higher risk. So I should be going in probably in my 30s, 35, much sooner, years
You saying
sooner.
something?
Yes, to get screened.
Mm-hmm.
So high
You
risk is
saying
very
something? I hear you loud.
Yeah,
Mm-hmm.
family history is very, very important as far as genetics and cancer. So yeah.
So those are the two big cancer deals as far as women's concerned. How about the ovary cancer? Would that be in the
Ovarian
same pile?
cancer, ovarian cancer is not something that they screen for normally. Most people that are diagnosed with ovarian cancer usually find it themselves, like they have cysts or lower abdominal pain in that groin area. And a lot of times it's too late when it's detected because there's no real screening tool for it. It's not like you can say, okay, I want to go for my annual ovarian screening. They don't have a annual screening. The breast, they do. The cervix with the pap smear, they do. But the ovaries, you don't. So unfortunately, that is usually caught in a later stage, ovarian cancer.
So what would be the how do you cure it? What would be the do you do it through surgery or is it
Well,
medically induced or
you would have what they call a oophorectomy, which is a removal of the ovaries. And depending on the stage of the cancer, once they biopsy it and stage it, chemo, radiation, and those types of treatments. But yeah, there's no screening tool for it. So yeah.
So we talked a little bit about the dangers that women have to go through. So let's talk about some of the young men. Now, prostate cancer and the different cancers that runs rampant with men. And a lot of men, they don't realize that they have cancer until they get ready to go through these symptoms. And usually when you feel the symptoms, it's kind of like too late. So when should a young man take a test to see whether or not he's in high risk for cancer?
The guidelines for prostate cancer in men, there are guidelines. I believe it's over the age of 45, they should start screening. However, if you have a family history, so say you have a father that had prostate cancer, that puts his son at high risk, at a very high risk. So he should be screening much sooner. And then they check for like what they call PSA levels. Excuse me. And if those levels are elevated, they should be followed. Yeah. But they have PSA screenings.
Yeah, we got to speak a little English here. I know, because some people don't. You say PSA, what the hell are you talking about? What, am I going to a meeting or something? So you got to explain to people what PSA means.
Well, that's not my specialty, but PSA screenings is prostate specific antigen. So that's what the PSA stands for. And it's just a simple blood draw that they use for the screening. And then you can also have the manual prostate exam as well. So those are the two screenings. Go in and the doctor examines you manually. You have to like cough, bend forward, that procedure.
Yeah.
And then the PSA.
That's where he sticks his finger in your butt. That's the one that's the I think that's the thing that mostly get most men is like, I'm not bending
Yeah,
over and getting nobody stick their finger in my butt. I'm not gonna do that.
yeah, yeah. It's a
I could
lot of
just tell
stigma
most
with
men.
that. It's a lot of stigma with that. However, you know, when you go, the providers, the physician, MPs, they're very professional. They talk you through it, um, and they make you well aware of every step of what they're about to do, so that you're not surprised by anything that's happening. But I mean, it is a necessary screening test as you get older. So,
Mm, mm,
and unlike ovarian cancer, there is no screening
mm,
for ovarian. So
mm.
if the men have this screening tool, that's a blessing, because we don't have one for all our parts. So
Well,
take advantage
how
of
about the
yeah.
colonoscopies? I mean, we both sharing that. How about when should a man or a woman take
Uh,
colonoscopy?
Colonoscopies used to be at the age of 50. I
Mm,
believe the numbers have lowered. It's actually 45 now for African
mm,
Americans, because there has been an increase in colon cancer in African Americans. And I guess
mm.
they attribute it to diet and not screening annually like they should when they're
Yeah,
supposed
I had a young man named Dr. LaRoche, and he was Dr. Larif, and he's a cancer specialist here in Monroe County, Pennsylvania. He's one of the top cancer specialists, and he was saying that a lot of African men don't go to the doctor. I mean, even my urologist, Dr. Grace Fan, she was saying that
Mhm.
a lot of times by the time African American men show up, it's a little too late.
Yeah, yeah.
Hmm.
Well, that's
Well, I would just
because
suggest to all you young men, and like Nurse Connie said 45. I'm looking at 40. I told my sons to start at 40 because I had prostate cancer. I am in remission. My brothers, notice I use an S at the end. All
wow,
right. Two of my brothers both had prostate cancer, and one of my brothers is in the stage 4. My
wow,
father had prostate cancer. So when they say it's hereditary,
yes,
here it is. I'm
sure,
proof. I'm living proof to show you. So I make
yeah,
sure that my sons, bro, you make sure you go to the doctor, make sure you get checked because um I could tell most men sometime in their life they're probably going to get prostate cancer. It's
okay,
probably something that you're not going to be able to avoid. Prostate, the cancer could be environmental. It could come from your dieting, and I tell you honestly, like Dr. Larif told me, he don't know where it come from. He says that he know what we get, but he doesn't know where it comes from. He said if we knew where it came from, then we can control it, stop it. We make medication for it. But he says you don't know where it comes from. Again, it could be diet, it could be environmental, it could be a number of things. But let me get back to you because the cancer was good. We got to talk about men. We got to talk a little bit about women. But I want to really get into you. So you seem to have some sort of passion for what you do. Is this something that you've always wanted to do?
um, I've always wanted to be a nurse since I was in high school, actually.
Mm,
And then I was steered in a different direction. And when I guess got to college, I shifted and wanted to go to medical school, but didn't have like the encouragement and the support to go to medical school. So that's how I ended up in cytology. So I became a board certified cytotechnologist, and
mm,
that where I learned about biopsies and pap smears and cancer screening. So for many years, I was the person that would screen your pap smear. Like if you went and had that cervical biopsy or that pap smear screening, I would be the one to look at it under the microscope and tell you if you had uh, vaginosis, uh, squamous cell carcinoma, endometrial adenocarcinoma. herpes,
Mm,
trichomonas, all those
mm,
different vaginal infection. I can actually diagnose cancer in every body site with the exception of brain and the heart. So if someone was to show me a sample of, say, the pancreas or the thyroid or the lung, I could differentiate and tell you if it's normal versus cancer. So I did that for many years, and which I was in a hospital setting. I went from the lab setting to the hospital setting, and I wanted to be from behind the microscope. I would go in for these, what they call FNAs, which are fine needle aspiration biopsies. And
mm-hmm.
it was a patient having a bone biopsy because I can diagnose bone cancer as well. So the physician was in there and he was getting me sample for the bone. And I was just standing there and I didn't want to be in my role. I was watching the nurse with the patient and I was like, I want to do what she's doing. I wanted to be the person
Mm.
holding the patient's hand and telling him it was going to be okay and you got this. And, so the whole time I'm standing off to the side waiting for the specimen so I can give the physician a preliminary diagnosis. I was just like, I wonder what he's thinking. Is he scared? Is he wondering, is this going to be cancer?
Mm.
So that was my aha moment that I wanted to do something other than cytology. And at that moment, that's when I applied for nursing school. And within a few years, I became a registered nurse. Yeah. And I've been loving it
And
ever.
you really enjoy what you're doing. Like I said, I can tell you have the passion for what you do. So I
Yeah.
was always wondering where this passion comes from. Do they call you Nurse Connie at home?
Up at home? No, I'm mommy at home. I'm
Yeah.
mommy at home, but at work, I'm Nurse Connie and, colleagues, Connie, Nurse Connie. Yes. So, but at home, I'm
Okay.
mommy.
Yeah. Well, that's like my wife when she comes home. She's the nurse. She takes care of us very, very well. Are you one of those nurses that they have great bedside manner when they're at work, but please don't let my husband get a cough. You know, because you treat him. If he gets a cough, it's like, you're just a big baby. You know how you nurses do. Yeah, when it comes to the
No,
family, that bedside manner
it's
is not
funny
so
on the
bedside mannery. Mm-hmm. My
no,
wife
on the
would tell you to take a
contrary, it's the
pill.
opposite. My husband take a pill.
He doesn't. He
No,
doesn't
my
do the
husband's
big baby
very,
thing.
very like no, not at all. Not at all.
I am. I tell you,
He's like a
I'm like a
herbalist
big baby.
almost.
Oh, he doesn't get
No, he's
sick.
not. He's tough guy. He gets sick, but for me to actually have to step in, he would have to be almost near death
Mm,
and totally like physically down and incapacitated.
mm.
No, he's yeah, he's not like that. He's like, I
No,
got
I
it, I
need to
got
be
it, I
more.
got my own little regimen, and he does his own little thing.
Mm. Yeah, I need to be more like that. I tell you, but once after you get hit with that big C, things change for you, and that like I
Yeah.
still have to go back and forth to the doctor, still get checked on a regular basis, but
Mhm.
your whole entire life changed because I used to be into bodybuilding. I was very much like a herbalist, like your
Uh,
husband, me, Mr. Green Tea and hibiscus tea. We were best friends, But
yeah,
like I said, this is where the psyche part comes in at, and this is where you deal with the mental part of it. So, how do you
yeah.
deal with people who, after they've had that, they've been hit with the big C or some big sickness? It could be a kidney failure, anything. How do you deal with those people, and what do you tell them? How do you treat them and keep them feeling like they can still make it to another day?
Well, you know, I had to deal with the big C myself.
Mm,
I was recently diagnosed with endometrial adenocarcinoma. back in November. It wasn't even that long ago. And I had to undergo a hysterectomy. And
Mm.
so I had my own, mental battle. And what worked for me was, I had good family support to start with. My sons and my husband, my mom, my friends, good support. And you have to, it's jarring. Like when you first, when I saw the diagnosis, because I actually saw it before my doctor told me, because now they have these My Chart portals with Epic. So when the
Hmm.
report came across, I read it, and having a cytology background, I knew exactly what I was reading, and it was almost surreal. So I had to do like a double take. Like, am I really reading this right? Endometrial
Wow.
adenocarcinoma, stage 1. So that was it. And then the phone rung, and then the doctor called me after they got the report, and they said, we need you to come in and go over your pathology report. And what worked for me was low stress, uh, a lot of taking care of yourself internally. You have to eat right. You have to exercise. You have to be around positive people. You have to have strong faith. And you just got to be determined that you're not going to be defined by that diagnosis.
Yeah, see that's
So
the
that's that
problem.
that's what.
That's what happened to me is that after I was diagnosed with it, that's like I really couldn't believe it. And I'm gonna tell you something. My wife being a nurse, she actually read through what the report was going to be or what the diagnosis was supposed to be. All of it's not in the report. So as far as we were concerned, I was in the
Right.
clear. I had even called the doctor and say, why do I need to come see you if I'm good? He says, you know what, you got to come see me. And then when I went to see him after
Oh,
he said, "But you have it," I didn't hear anything else after that. Whatever else he said was wah 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 because I couldn't. Mine was done. So it took
yeah, yeah.
people like you and my wife. She's a nurse, so it took people like you to kind of keep me up on my feet because I was very much down and in a depressed state. I mean, pretty much at my age, I didn't know what the hell was going to happen.
Right.
I'm right as soon as that I hear you got to see me. I'm checking my will. I'm checking to make sure everything crossing my
No,
T's and dotting my I's because it is a
that's
very, very scary experience. You
yeah.
know.
Yeah, it's very
Mhm.
scary. It makes you reflect on life, what your purpose is, um, having second chances, like, okay, you survived this. You have this diagnosis now. What are you going to do about it? Like,
Mm.
so are you going to be the voice for Black women or minorities that are dealing with endometrial adenocarcinoma and abnormal bleeding and issues with perimenopause and menopause? So that is the pathway I'm taking now. Is I just want to be a voice. I want to share um, that you have to ask questions, get second opinions, um, be your own advocate, self advocate. If the physician or that mid level provider says something that doesn't sit right with you, you question it. And then it's
Mhm.
okay to get another opinion and to advocate. And no one knows your body better than you. So it doesn't matter how many credentials you have or letters behind your name. You've been living with you for how many years? So you know what is normal, and you know when something's off, whether or not you admit it or are self aware, but you know that one little something's like different or off, and you know that that's not normal. You've been going through life all this time, and no one's going to tell you because they have a white coat on that what you're feeling isn't what you're feeling.
Right.
So
Well, what about? I would say it's not a one shop thing, so everybody's going to be a little different. It's not a one size fit all type of deal. But I wanted to
absolutely.
ask you. So when you talked about the hysterectomy, I noticed that that was something that they asked a lot of black women to do when they had what do you call ovary problems or any type of what men would call female problems. It always seems that the answer was to get a hysterectomy.
See, mine was in the reverse. I requested that because I was having what they call abnormal bleeding, and I'm at that age of perimenopause. So is it abnormal bleeding or am I perimenopausal? But I know that you should not have sporadic vaginal bleeding no matter what age you are. It's not
Mm.
normal. So if you're perimenopausal, you shouldn't have a period. They say for 12 months, no period, you're quote unquote in menopause. So I was right at that age where they say 50s, where you can be perimenopausal. You're hot flashing, you don't know. But my gut feeling was this can't be normal. This isn't normal. You shouldn't have sporadic bleeding like this on and off for months. Then it stops, it comes back. And so I wanted to get it checked. And I chose, there were options. You can get an ablation, you could do hormone replacement therapy, or you could do a hysterectomy. I'm at an age, my youngest son is 23. I don't want any more children. After ablations, those symptoms can come back. So I chose to have a hysterectomy. But when I had my hysterectomy and they sent my tissue for pathology, which is the normal practice anytime you remove tissue from the body, they send it for testing just to see if there's any abnormalities. My pathology came back abnormal with stage 1 endometrial adenocarcinoma. Thank God it was caught early because the treatment for endometrial adenocarcinoma is a hysterectomy. I had a hysterectomy anyway for abnormal bleeding. So I was good.
Mm.
So stage 1, they caught it early. The lesion never invaded what they call the myometrium, which is the outer layer of your endometrium, pretty much your womb where you childbear and you carry your fetus. So
Mm.
it was in that superficial layer. So I was good. I didn't require chemo or radiation, but I do follow the 5-year plan for persons that are diagnosed with cancer. So I have to go every 3 months for vaginal exams for like 2 years, and then I have to do a every 6 months in the third year for another 2 years, every 6 months, and then the last year it's once a year until I'm cancer free for 5 years. So I'm in that window right now where I have to go for constant checkups, basically vaginal exams and such to make
We're in the same boat. I tell you what, you take one or I'll take
yeah
the other, and we can just battle along because we're all in the same boat. As far as we got to keep getting checked up, and
yeah yeah
and I did the clinical trial, so they constantly sticking a needle in me, seeing what's going on. You know,
yeah.
but it's just
What I
amazes
would
me
like
is
to
people.
share though
Go ahead, I want you to hear it. Let me get that.
is like hormone replacement therapy. That's something I find that they push on women, and certain hormones are precursors. They will develop cancer, endometrial cancer,
Oh, really?
and breast cancers. Absolutely, estrogen and progesterone. So I didn't want to take any of those hormones, and thank God I didn't, because once I had the hysterectomy and they sent my markers, I was 100% for estrogen and 90% for progesterone. So had I taken those hormone replacements to stop the bleeding, the abnormal bleeding, it would have just grew the tumor because it would have fed it, because I have those markers. So if I would have taken progesterone, my body would have fed off of that and the tumor would just grow and grow. And then the downside is I would have stopped bleeding, but when I would go for my annual pap smears, it wouldn't be detected because the pap smear only swabs the cervix and the vagina. It doesn't go into the endometrium. So it would have never been caught. It would have never been caught. So thankfully, I advocated for myself and said, no, I don't want to take progesterone. I don't want to take estrogen or any hormones. But that's what they were prescribing. And I know in my wisdom and experience from doing cytology prior to being a nurse that those hormones will cause different types of cancer. So I didn't want to take it. And thank God I didn't, because I would have probably stopped the abnormal bleeding. I would have still had my womb. I wouldn't have had a hysterectomy, but I would have had this tumor that would have been feeding off of progesterone and estrogen. And I would be in
So
big
what
trouble
was
down
the
road.
exam that you had to take to detect this within your body, so you knew not to take a hysterectomy? I mean, I'm sorry that you took the hysterectomy, but you wasn't taking the hormones. What was it that what test did you take? What did you have so that you learned about your body?
It's my experience in cytology. So it's just having the knowledge that a lot of people don't have. I went to school for that. I diagnosed cancer for 17 years before I was a nurse. So just in my education, I knew about certain drugs that would cause cancer. And so it was just intuition. I never wanted to take hormone therapy because you could take, say, a cancer that would help breast cancer, say like tamoxifen is a chemotherapy drug for breast cancer, but tamoxifen causes endometrial cancer. Everyone doesn't know that. I know that, or clinical people, I know that because I was in the world of diagnosing cancer for many years. So I've always known that there are certain drugs that will cause cancer. So when my gynecologist said to me, oh, it's just a little, you're perimenopausal, just take the progesterone, it'll stop the bleeding. I said, absolutely not. I said, I'm not taking that.
This is what I could tell you about that is that you say, I could tell you a few more people know about this now because of what we're doing right here. So this is why I asked that you come on the show, and you're very knowledgeable, and it's greatly appreciated. You're willing to share this knowledge with an audience. Because believe it or not, you're probably talking to a couple of hundred people. Maybe when we do live, it's about 100, 200, and we start to scroll up from there. And by the time everything's all said and done, it's maybe about a couple of thousand people have watched your show. So you're giving out a lot of good information that's needed. And just for those that are watching, Nurse Connie plans on being Nurse Connie permanent and have her own show here. So you guys, you can call up. The number's there. You can always call up. You can leave a comment if you have a question for her. We sure like to know. I mean, I know I'm a host and I got a list of questions that I like to ask, but you guys may have some other questions that actually may need to be addressed. Okay. So Nurse Connie, we're going to say thank you because we're just about getting close to the end of the show. I usually run a commercial, but I decided not to because I think the information that you had is it needs to be told and people need to hear it. So I still got to do the time thing though. Okay. So we're going to get ready to cut this short, and I'm going to say thank you very much for coming on. Well, what was it? We decided Wednesday, 4:00. So look forward to. I came up with a name, and I think she agreed with it, and we're going to call it Wellness Wednesday with Connie the nurse. Okay, I'm sorry, with Nurse Connie. with Nurse Connie. Okay. And we got a whole little logo that we're making up for her. So you guys can tune in at any time and listen to her. If there's medical questions that you need to ask. Don't be afraid. Don't be shy. Just go ahead and ask. No question is the wrong question. No question is a dumb question. If you don't know, she's here to say, so you don't know, now you know.
Yeah.
So Nurse Connie again.
And make a difference.
So I guess the next time you come on, you did have a couple of subjects that you wanted to talk about. Just to we'll use it as a, what do they call it? Something that you can start off, a prelude, the word that they call. There's a word for it. But when you come back, you can start off with where you're leaving. Prelude, okay.
Prelude.
So what is it that you wanted to talk about? We got a couple more minutes.
Well, I did want to focus on women's health, endometrial cancer, abnormal bleeding, questions to ask when you become perimenopausal, those types of questions. What do you do if you're feeling uncomfortable with your provider? Get out of there immediately. Get a second opinion, because that little feeling that you have inside, that weird, or someone on your shoulder, that's called discernment. That's discernment. And that is your inner self telling you when you know what, something's not right. Your body's a little off balance or out of sync, that little gut feeling you get. So sometimes you have to listen to that and question it, and seek more information when you feel like that. Don't make rash decisions.
Okay. Yeah. Sounds like an excellent thing. And again, thank you very much for coming on. And I guess we'll see you next week at 4 o'clock.
All right. See you guys. Okay. Bye.
All right. Hope you guys enjoyed the show. Thank you very much for tuning in. Remember, this is the Empowerment Show. My name is Kendall Stevenson. We are on the Empowerment Network. Please be advised, we do have other shows on this network. We start out Monday to Thursday. On Monday, we have Mental Health Mondays with Hope. She slides up in the studio somewhere around about 6 o'clock. Then on Tuesday, my man in Yates, we get into those tough conversations, those knock down the door conversations when we're talking about politics. We try to bring you the truth as to the way we see it. On Wednesday, we have this show, which is the Empowerment Show. And of course, we're going to have the new show when we do Wellness Wednesday, and that's going to be with Nurse Connie. On Thursdays, we have Daughters of the Divine Joy, and I know you guys love her. Her name is Diane Butts. So again, thank you guys. You guys should applaud yourself. I'll applaud you. Kendall Stevenson, and we like to say Ashe. Peace.
Welcome to the Empowerment Show, when knowledge meets action. Yeah. We break down barriers to financial literacy. Speak truth to power. Conversations, voices that inspire change, challenging the status quo, tools for building wealth, taking control. Your future starts right now. This is the Empowerment Show.